Are you a cyclist struggling with knee pain and wondering what you can do about it? It's getting to be that time of year where we're going to be able to get outside and get back on your bike. So if you're struggling with knee pain, then today's video is for you. We're going to be talking about the different types of knee pain that most commonly affect cyclists and a little bit about what you can do for each type of knee pain. Ready? Here we go. All right, first up, we have anterior knee pain. So this is the most common cause of knee pain with cyclists, is that you have pain on the front of your knee, so right underneath your kneecap. This is called patellar compression syndrome, and what happens is that the quadriceps, which is the big muscle in your thigh, gets really tight because obviously you're using it a lot when you're cycling, and it causes the patella, or the kneecap, to get pressed down on the femur. Now, on the back side of the patella and the top side of the femur, you have cartilage, which is kind of this squishy substance that helps to keep that pressure from building up. But it needs to be able to glide correctly. So the patella is supposed to be able to glide on the femur. When you're biking for long periods of time and the quadriceps are tight, it causes a compression that causes pain on the anterior aspect of the knee. So what do you need to do about it? Well, first thing you want to do is make sure that you're stretching your quads. You want to make sure that your quads have a good length and they're not getting too tight. This will help the patella to be able to move more correctly and get that gliding that it needs to be able to heal. You also want to make sure that your VMO is really strong. If you've been cycling for a while, you have probably heard about the VMO because it's really important for cyclists, and that's the medial aspect or the inner aspect of your knee. So the quadricep muscle has 4 heads, and the inner aspect is called the VMO, vastus medialis oblique. It's really important to strengthen that muscle to make sure that you don't have pain when you're riding your bike. The other thing that you want to make sure you do is stretch the outside of your thigh. So you have that IT band, and again, you've probably heard of that before, which can also get tight, and when it does, it pulls that patella or that kneecap out to the side. So you have the IT band pulling it to the outside, then you have, if you have a weakness in the VMO, the vastus medialis oblique, then that's not counteracting that, which causes more compression on the patella. So you want to stretch your IT band, stretch your quads, and strengthen your VMO if you're suffering with anterior knee pain when you're biking. But what if you have posterior knee pain when you're biking? Most commonly, this is caused by a Baker cyst. Now, a Baker cyst is kind of a fluid-filled pouch that's supposed to be like the overflow compartment. So when your knee joint gets swollen, there's kind of an overflow valve in the back, and everybody has the overflow valve. We're just not supposed to have anything in it. But when you get something in it, when you get that fluid, that inflammatory fluid in it, it's called a Baker cyst. So if this is happening to you, it's because you're overextending your knee when you're biking. So if this is happening, what you want to do is either move your saddle down a little bit so you don't have that full extension right at the end. You want to keep just a slight bend there, or you need to move your saddle a little bit further back to avoid that. So changing the saddle height is going to help affect that Baker cyst. Now, what if you have pain either on the inside or the outside of your knee? If you have pain on the inside, that is most likely the medial collateral ligament. If you have pain on the outside, it's most likely the lateral collateral ligament. So these 2 ligaments help to keep the tibia and fibula, so the smaller lower leg bones, moving properly on the femur. So they are critically important, obviously, when you're riding your bike. So if those are a problem, if they get strained and kind of stretched out, they'll become very painful. I've had a lot of bikers ask me, did I have a tear in my medial collateral ligament? Sometimes they'll ask me about lateral collateral ligament if their pain is on the outside, but most commonly they'll say, did I tear my MCL? That's pretty rare with biking, unless obviously there's a crash or an injury specifically, but the repetitive motion itself doesn't usually tear the MCL. It usually puts strain on it. And this is due to abnormally fitted cleats. So your cleats are not fitting correctly, and that's causing, when you do that repetitive motion, it's causing strain on either the MCL or the LCL. So if you notice that after a long bike ride, you have pain either on the inside of your knee or the outside of your knee, and especially if you don't notice this pain with other, regular activities, it's just with biking, check how your cleats are fitting. And we have a video here also that we can link here so you can see exactly how your cleats should be fitting when you're on the bike. Now, if you have maybe a lateral knee pain, but it tends to go up towards your hip, that's a little bit of a different issue. So the LCL, lateral collateral ligament, is just right at that knee joint. It does not extend up towards the hip. So if you notice that you maybe started having knee pain that was on the outside of your knee, but it started going up towards your hip, then that's probably that IT band. So that's called IT band syndrome. And if it's been bothering you, as it progresses, you will definitely notice it transferring up. Sometimes it can start at the hip and transfer down to the knee as well. Most commonly in bikers, it will start in the knee though, and it will transfer up. So if you've ever struggled with that, you definitely know how frustrating that can be. And it's something that you do want to deal with pretty quickly, because if not, it can start to cause more anterior knee pain, and then you end up with more of that anterior compression syndrome. And we don't want it to progress to that. So if you have some tightness on the outside of your knee or all the way up to your hip, what you want to do is be stretching that IT band. Now, I know a lot of bikers who really like to foam roll their IT band. I am not a big fan of foam rolling on the IT band in particular. One, it puts your back in a really awkward position. Two, it's extraordinarily painful. And three, we don't necessarily see that there's any benefit to the tissue itself or the tissue directly when you're foam rolling on that IT band. And why go through all that pain if it's not really gonna help you? So here's what I recommend you do instead. You take a racquetball and you wanna work through the IT band. So you can just put your hand on the side of your leg with a racquetball and you can kind of massage it along that IT band, which will kind of replicate the idea of the foam roll, but you don't have your full weight against it. You just have your hand pressure. So that helps to get that IT band moving a little bit more. Since it's a fascial structure, it doesn't have a lot of blood flow. And that's why I recommend the racquetball as opposed to the foam roller, because foam rolling is going to cause more trauma, let's say, and it's harder for it to heal. With the racquetball, you have less force applied, which means less trauma, so then your body can actually heal what's going on. Because remember, every tissue in your body is designed to be able to heal itself as long as it's moving correctly. So the idea with the racquetball is really to help that IT band move better so that it can heal normally. The other thing you're going to want to do is strengthen your gluteus medius. So this is the muscles that's on the side of your hip. So if you put your hands on your hips, then your hands are resting on your gluteus medius. This is a very important muscle because it attaches into the IT band. So if you do some hip abduction so you can stand and kick your leg out to the side, that's a really great exercise just to warm up that gluteus medius, which will help take some pressure off that IT band. If you're suffering with knee pain from biking, I hope that you found this video helpful. If you have any questions, definitely drop them below and we'll make sure to make a video to answer them. Have a great day.